The types of female patients that would be referred to me here would be perhaps a breast patient who had what we call systemic anti-cancer treatment, or commonly known as chemotherapy, prior to their radiotherapy. And a treatment such as this affects the whole body. So nausea or vomiting could possibly be a side effect. And these ladies might have already incurred some weight loss prior to commencing their treatment here. So for these types of ladies, we're looking at a little and often approach, and looking at foods that are naturally high in fat. So what we'd say, fortifying your diet with butter, cream, grated cheese, and adding sugar to your foods, and avoiding long gaps in between meals, and looking for help. Sometimes we try to do too much, particularly as a mother myself. There's a lot of other things in the equation, and so sometimes it's just keeping things simple and maybe preparing ahead, batch cooking, small portions at a time, and then just bland foods, staying away from any strong smells, and maybe eating cold foods instead of hot ones. And then the other types of patients that would be referred would be our gynecological type cancers. So they would be receiving pelvic radiotherapy. And for any patient receiving pelvic radiotherapy, it can cause altered bowel habits, particularly in the latter phases of their treatment. And sometimes a lower fibre diet can help with this. It would be typically a kind of an irritable bowel type symptom, and it might mean cutting back on high fibre foods in your diet, and increasing your fluid intake also, to replace any losses. So I would see these patients, and we would go through what their habitual diet would be and see if there's any areas that we could improve on to improve their symptoms.